Hello boys and girl, this is going to be a different type of video, more of a story time or rant if you will, a tea time. And I've seen some buzz surrounding my most recent video, but I haven't really been keeping up with it very much, and you'll see why. So what is the tea? Well, I have blood cancer, and not the boogie type of cancer either. Aside from being a different disease, it's also, actually real. A few days ago, I was actually going to record a script for a new video on a pretty interesting topic when I decided to go to my normal physician because I was seeing spots and having headaches behind my eyes. After initially thinking it was due to tension headaches, the doctor called me to recommend I get some scans to rule out more serious conditions. I ended up getting a head CT, which came back normal, but after this, a nurse walked up to me and asked, "Do you always look like that?" Which certainly sounded a little rude. I was a little taken aback, but apparently I looked pale and she thought I could be anemic. So she had me get blood work done, and after a few hours of waiting, my white blood cell count was extremely high and contained a large amount of cancerous cells. So after waiting till around 2:30 a.m., a total of 9.5 hours in the hospital, I was transferred elsewhere for further testing. After being poked about 80 more times, and after a bone marrow biopsy and aspiration, which was one of the most painful experiences of my life, I was confirmed to have acute myeloid leukemia. I'm still waiting on the exact subtype to be confirmed to start an exact treatment plan, but I've already had a catheter inserted into my heart and taken a few medications, including a sort of precursor to chemotherapy. So far, my symptoms are limited to the same headaches as well as lightheadedness, extreme fatigue, and weakness, but obviously we can expect it to get more serious. I will possibly lose my hair, in which case I may need to make drastic changes to my avatar, along the lines of this. I also have to wear a giant mask all the time, which makes me look like a bug, because my immune system is weaker than an In Praise of Shadows argument. Do you guys remember how he said the incestuous cannibals in the hills have eyes were analogous to black people and Native Americans? I like that one. But it's all good because he also thinks they were the good guys. Anyway, I've also had to get multiple brain MRIs, which give me pounding headaches, but don't worry, they told me that's normal. And unless you like to lay in confined spaces, listening to 18-wheeler horn ASMR on full volume, it does make sense that it's normal. Overall, I'm just so excited that I finally get to experience my favorite shows like House, Grey's Anatomy, and Dr. Mike, but in real life. I just get so giddy when they say words like attending and nurse and cancer. I do kind of wonder where all the yelling and screaming and Vicodin abuse are, but they must just do those in the other wards. And the room is nice enough, but I really should decorate. If you somehow don't know what I was referencing earlier, Boogie2988 recently admitted to lying about having polycythemia vera, a type of blood cancer, and while he claims to have never explicitly started a fund for his treatment, it's apparent to many that he benefited from it monetarily, and others would point out his crypto scam and other relevant instances of him taking money from his audience and blaming it on cancer.
So, Boogie has maintained for a while that he has cancer, and a lot of his reasoning behind his most recent cryptocurrency scam was that he needed the money for his medical treatments with his cancer.
As a result, a massive live stream was held with appearances from XQC, Destiny, and even Mr. Medicare, a lost commentary name who disappeared due to actually having cancer. Boogie, while being his usual, dramatic self.
So your shred of privacy is this, but not being naked on film, not talking about fucking wars, not talking about being naked.
I'll get naked right
now.
now.
Do it. Take it off. Let's do it.
I hate being alive. I hate being alive. I hate breathing. I hate being alive. I'm in tremendous pain. I'm in tremendous pain. Help me, help me, help me. I'm in so much pain. I'm in so much pain.
Totally freaked out, but eventually admitted to wrongdoing, and even got this really cool tattoo. Hey, I know I don't have the same type of cancer as he pretended to, but I do have a blood cancer, and that's close enough. And since I now personally relate to the situation, I've decided that that's fucked up. It's messed up to fake cancer because cancer is real, which I now know, and that sucks. In other updates, Sensitive Society has made a video titled Addressing Everything, in which he responds to some criticism coming his way, and he makes a pretty fair point here.
I have noticed a shift in the comment section. I don't know if that's because of the whole Mr. Beast situation, which I'm leaning more towards that one, because it's a very controversial situation. No matter what I say during that situation, I'm going to get hate. If I completely, disagree with Pac-Man and I'm Team Jimmy, I'm a Glazer. If I hate Mr. Beast and I'm full Dog Pack now, I'm on his team, I'm going to get hate. No matter what I say, I'm going to get hate for it. And that's not me crying or complaining, okay? I just want to put it out there. This is not a, why, you know, I'm getting hate. I do think it's important to address some of the criticism, not just regarding Mr. Beast, but everything overall. In situations like these, like the Mr. Beast situation, allegations, and other stuff moving forward, unless we have undeniable proof, we should wait for the other side to respond. That should be common sense.
But at the same time, he doesn't really talk about the reason people are criticizing him, which is his DM to Lava, in which he comes off a little unhinged. However, he does reference this one post on Reddit that compares him and Cheeto to Sneeko, and I just wanted to clarify again that you shouldn't do that. Sneeko is much worse than those commentary channels, and maybe it's because things have been put into perspective for me recently, but I don't think they ever did anything super bad. I just talk about whatever's interesting to me, so don't believe this darkness bat demon either, guys. It's not that deep. Anyway, I'm just kind of rambling. I've been told I'll be in the hospital for at the very least a month, and I'm likely to become extremely weak and possibly even slow in the brain, so I may end up making a few Pegasus videos.
Dude, my susso meters are going off on everybody. I got red laser eyes. I'm about to Homelander everybody with laser vision right now. Nobody is safe. Everybody's a PP, bro.
No, I'm just kidding. It can't be that bad. People are even starting to realize how much he milked the Mr. Beast stuff.
Is that dick good? Yes, kid. How good is that dick? Oh, how good is that dick?
Classic Golden Boy W. If you would please consult the graph to reference the quality of my top tier usual content versus my hopefully temporary content. Because I'm not a commentary slop YouTuber. I am much more refined, like a commentary puree YouTuber or something. Maybe I can start making cancer patient reacts videos and cash in on that Dr. Mike train. Who knows?
Your house is out of control, but so am I. Let's watch this episode. Beep-whoop. I've never heard a speech given that dramatically on an intern's first day.
Or I can document my journey and hopefully recovery until I'm able to make my critically acclaimed, universally loved content again. I will say that it's very nice to know that while I don't have the biggest audience, I have some people who watch my videos not just for the topics, but for what I have to say, and I'm really grateful for that. I hope to be able to use my channel as a way to stay sane and hopefully keep making content, and while I can't promise anything, I'll do my best to make that happen. Don't cry for me, Golden Boy Army. Well, maybe a little, but I will fight as hard as I can. Leukemia? More like pookemia. Yeah. Well, make sure to like the video if you liked it, but you're not allowed to dislike it because I have cancer, and that'd be fucked up. But you can comment with your thoughts, and if you really need to, you can comment dislike, just to be different. And make sure to subscribe to see me punch cancer right in the balls. We could run a clinical trial to see if having more subscribers makes my immune system stronger. It makes sense because nothing bad ever happens to famous people. Alright, I probably have started or will soon start chemo by the time this video comes out, so wish me luck. See ya.
This guy kind of looks like Benedict Cucumber Bitch from the new Zoolander film. I'm one of the few content creators on this website who doesn't joke about cancer. Take any other channel. Good Mythical Morning. They should call it Good Cancer Morning because all they're doing is joking about cancer the whole fucking morning long. Jenna Marbles? You mean Jenna Cancer? All she's doing is joking about cancer the whole time. Pewdie Cancer, you say?